We expect medical centers to be safe spaces, sterile sanctuaries dedicated to healing. But for the people working inside, the reality is much darker. This modern nursing station looks exactly like a standard, safe clinical environment. But according to the Taipei Physicians Union, wards exactly like this at Shuangho Hospital became the site of severe workplace bullying and harassment. This protective lead apron highlights the specific physical hazards weaponized against female staff. Supervisors actively ignored maternal protection laws, forcing pregnant doctors to work night shifts and exposing them to ionizing radiation, high-energy waves that can penetrate tissue and cause severe fetal harm. The boundary violations escalated rapidly. In one documented incident, the accused supervisor entered a recovery room and physically rubbed an incapacitated female doctor's hands after a recent miscarriage procedure. The victims documented these abuses thoroughly. Yet, they found themselves forced to resign just to protect their own safety, while the supervisor accused of groping them stayed comfortably in his position. The doctors actually did everything by the book. They gathered their evidence and filed formal complaints, trusting the institutional machinery to protect them. This animated blueprint shows why that trust was misplaced. The reporting system failed through a highly coordinated three-part breakdown: internal hospital cover-ups, unchecked academic power imbalances, and heavily fragmented government oversight. In a medical hierarchy, filing a formal complaint rarely triggers a pursuit of justice. It triggers a defensive lockdown. Shuangho Hospital publicly claimed they took swift action. In reality, they completely failed to separate the victims from the perpetrator, forcing traumatized doctors to sit through department meetings with the man they had just reported. The hospital's internal committee eventually issued a penalty, a single minor demerit. They kept this decision secret, refusing to inform the victims about the investigation results or the reasoning behind the light punishment. Then came the public relations spin. The victims clearly cited sexual harassment in their official resignation letters. The hospital ignored those documents entirely, telling the media that the doctors left due to career planning. The internal investigation actively erased the victims' truth, prioritizing the hospital's brand reputation over the safety of its staff. To understand why nobody else spoke up, you have to look at medicine's white tower culture. A medical supervisor holds dual authority. They control your clinical shifts in the hospital, and they grade your academic progress at the university. Look at this organizational flowchart. Because the hospital handled the complaint internally, they never reported the misconduct to the supervisor's affiliated university. He absorbed a minor penalty on the clinical side, but his academic authority remained totally intact. He kept his teaching roles, he kept his influence over medical societies, he retained absolute leverage over the careers of medical students and junior doctors who rely on his evaluations to graduate. The institution hands the abuser a pristine academic record, turning it into a loaded weapon aimed at any junior staff member who might think about blowing the whistle. This imposing government building represents the next logical step. When internal mechanisms fail, victims turn to the state for external oversight. This diagram maps the bureaucratic trap waiting for them. Jurisdiction for a single hospital harassment case is shattered across three entities: the Ministry of Health, the Ministry of Labor, and the Ministry of Education. These agencies operate in silos. Communication breaks down immediately, and the victim's complaint gets caught in an endless loop of bureaucratic delays as departments argue over who has the authority to act. The government even built a specific tool, the Wolf Doctor platform, designed to track serial abusers. It is entirely useless. Hospitals simply choose not to report their staff under the Physician Act, bypassing the database completely. Every agency holds a fraction of the responsibility, which means no single entity actually enforces the law. The perpetrator simply walks through the massive gaps in jurisdiction. The state's tangled oversight framework acts as an unwitting accomplice. It structurally guarantees that hospital cover-ups succeed. Look at the physician in this portrait. These systemic failures result in a profound violation of occupational safety, driving highly trained, talented women entirely out of the medical field to escape abuse. Patient care quality is strictly tied to workplace safety. You cannot operate a functional medical ward when the staff administering the care is subjected to relentless terror and retaliation. Fixing this requires blunt policy changes, standardized reporting pathways, mandatory external investigations, and severe public penalties for institutions caught hiding abuse. The traditional medical hierarchy allows a supervisor to trade a minor administrative demerit for major physical abuse. That structure has to be dismantled. True restorative justice starts with closing these regulatory loopholes. Support healthcare labor unions, demand strictly enforced reporting laws, and ensure that the next doctor who speaks the truth isn't the one punished for it.